Good afternoon, everybody. Thank you for joining us for the Family Connection Forum for March 2025. I really appreciate everybody's time, and we're excited to meet with everybody and hear all the feedback. We have a really great agenda today, so I'm going to jump in and get started. So you may notice our name is Family Connection Forum. Previously, this meeting was called the Family Advisory Council. So it's the same meeting, just a different name. I do want to highlight that we do have captions available. We will be using a feature where you can submit your questions, and for folks who are interested in using the captioning, a link will be shared. We also have our ASL interpreters who are spotlighted and visible throughout the recording. Thank you to our ASL interpreters for your support. As a reminder, please remain muted when you are not speaking. Your video is encouraged to remain on, and today's session is being recorded. A recording of this presentation will be available on the DODD YouTube channel and our website upon availability. By attending this meeting, you are giving DODD permission to include photos or videos and audio in future areas. So jumping right into our agenda, we'll be meeting and learning about direct support professionals. We'll be getting some updates on the OhioISP. Our community life engagement team will be joining us, giving some updates. We'll get updates from Medicaid Development and Administration, some updates for families, and also some time with our leadership. So what is Family Connection Forum? It's an opportunity to learn about changes that impact people's lives, and also an opportunity for families to share their experiences with leaders by engaging in conversation. So the intent of this time is to hear firsthand information from multiple folks, focused on issues that affect people across Ohio. If you do have a particular concern about your personal situation, those will be handled on an individual basis, and we'll be happy to connect with you after this meeting. We wanted to share a few terms that you may be seeing throughout this presentation. Our system loves acronyms, so I'm sharing a few slides here. You can see CMS, DSP. These are some terms that we use on a regular basis. So if you would like to see these are some terms you may see later. So to start us off, I'm going to turn our presentation over to Ann Wisen, our statewide manager for direct support professionals and provider supports.
Thank you so much, Meredith, and good afternoon, everyone. Appreciate the invitation to be here and to engage with all of you and tell you a little bit about what our team does. And so as Meredith said, we do use a lot of acronyms in our field. And so our team supports direct support professionals and other providers, and we use DSP a lot in our conversations when we're referring to direct support professionals. So who are the members of the DSP and provider support team, and what do we do? Our goal is to assist providers, direct support professionals, which may include independent providers, or it may include a direct support professional who's an employee of a provider agency. We work in many ways to assist them to deliver quality-driven supports to Ohioans with developmental disabilities and their families. We know that in Ohio, many individuals are receiving supports in their family home. And so it's imperative that we ensure that there are good relationships between not only direct support professionals, providers, and the people that they support, but also with the families. And so we strive to support those DSPs in ways that ensure the delivery of quality services and increase positive outcomes for people supported and their families. We focus on building connections between providers, people, and families and county boards, and identifying and sharing creative and innovative workforce solutions. I'm sure that all of you know that workforce has been a major component of our focus over the last few years, given some of the challenges in Ohio's direct support workforce. And then also we provide a lot of resources and technical assistance, again, not only to DSPs and providers, but to people supported and their families, and also to county board staff who are engaging with providers and people supported. Next slide. And so I just want to quickly introduce you to my team. Unfortunately, both of my coworkers are on the road today, and I don't think they're able to be on the call with us. But we, the three of us, serve all 88 counties in Ohio. And so we have the assignments split up based on Ohio's regional map, and I will show you that here in just a moment. But Michael Hogan, who is a DSP and provider support specialist on my team. He supports the counties and in regions 4, 5, and 6. And Angie Blake, the newest member of our team, supports counties in regions 1, 2, and 3. Next screen. So a little bit about what we do, the specific things that we do to work towards meeting those more general goals that I talked about in my introduction. Our team manages many workforce related projects. We were very lucky this past year to receive some federal funds to help focus on supporting Ohio's direct support workforce. And we're actually going to culminate that particular project with a symposium coming up March 26th, where the grant awardees will be coming together to share out some of the projects that they did during the grant period to come up with innovative and creative ways to support Ohio's workforce. We publish a monthly DSP Connection newsletter where we share information, resources, and other items of interest with Ohio's direct support professionals. We also support the competency-based longevity add-on process. So for those of you who may not be familiar with that, Ohio has a add-on to our waiver program that allows direct support professionals who meet eligibility criteria of at least 2 years of employment in the field, providing direct services, and the obtaining 60 or more credit hours in certain training areas. And for direct support professionals who do that, they are eligible for an add-on to their waiver rate, which then can be passed on as a wage increase. And so we help with that process. We also help maintain compliance when a provider agency or an independent provider has maybe had a poor outcome from a compliance review, and they're working with our compliance team to come into compliance and kind of strengthen their systems. We do follow up with them to ensure that not only were they able to get their plan of correction implemented, but that they're able to sustain that long term. So we're following up with them a few months after their compliance review is completed, just to ensure that they have what they need to continue that successful systems change that came out of their compliance review. And then we also provide crisis support for providers. During the pandemic, we spent a lot of time working with providers to assist them in meeting their needs for PPE and other supplies. And as we've transitioned out of the pandemic, we spend a lot of time supporting providers when they might be in crisis around workforce. Maybe they are short-staffed and they're having to evaluate ways to address their needs and meet the needs of the people that they're supporting until they can get fully staffed. We also sometimes run into situations where there are weather emergencies. We've had some frozen pipes that have required relocation of individuals. In the past, we've helped support providers when they have had issues with damage from tornadoes and other weather emergencies. So we step in to support providers in times of crisis. Next screen. We also, a couple of years ago, started monthly information sessions for providers and direct support professionals. What we found is that our field and our department did a wonderful job of providing lots of opportunity for training, but we didn't always provide that training in a way that was compatible with the experience of the direct support professional. So we take a lot of the same topics that you all as families, folks with lived experience, and also other professionals in the field may participate in. And we really try to make sure that the conversation is relatable for our direct support professionals. Obviously, we know that people learn better when they can relate to the experience. And so we've had a lot of positive um, response to that, and we think it brings a lot of benefit to the field. We also work to help people who are interested in becoming direct support professionals. Again, whether that is by being certified as a new agency or if that's being certified as an independent provider, we work closely with our provider certification unit to make sure that those folks who are interested have a really good base of knowledge before they start that process and that they really are moving forward in an educated way. And this is something that we want to look at enhancing in the future. And then we also spend, again, as I said, a lot of time out in the field working directly with our direct support professionals, our providers, and staff at the local county boards who do similar work to us, who are supporting providers at the local level. And so we attend a lot of DSP focused functions. Those might be provider fairs, where counties are setting up opportunities for providers to meet with families and people looking for services. We participate in local trainings. We participate in local provider support meetings. And our most favorite, usually in the month of September, is what we call the DSP Appreciation Tour, where we spend as much time during the month of September, which is DSP Appreciation Month, really out there making sure that Ohio's direct care workforce really knows how well they are appreciated. Next slide. We also support a program called DSPU. This program is managed by the Ohio Alliance of Direct Support Professionals. And OADSP, as they're called for short, is a group that focuses on empowering and educating Ohio's workforce. And the DSPU program is a program that came out of a collaborative effort between DODD and the Ohio Department of Education and Workforce, supporting young adults who may be in their junior or senior year of high school and may be interested in a career in direct services. And so this allows them to learn more about the DD system, more about service delivery in our system, and gives them some opportunity for experiences with existing providers so that they are moving potentially into this career path straight from high school with a good base of understanding and knowledge to successfully be a direct support professional. Ohio Alliance of Direct Support Professionals also offers an annual DSP Summit, which is a conference geared directly for direct support professionals to offer training and educational opportunities. And then they culminate their year in September, providing a wonderful free DSP recognition event. And DODD is just thrilled that we are able to sponsor and support the activities of OADSP, again, in helping to empower and educate Ohio's direct support workforce. Next. So I talked a little bit about the opportunity that we had in 2024 to do a workforce support grant. And we had 34 grantees that were awarded funds to implement projects and initiatives related to the areas of DSP personal supports, DSP professional supports, mentoring for directors of operations or DOOs and frontline supervisors, looking at ways to improve the organization's culture to focus on direct support professionals, initiatives around building and maintaining relationships, and awareness campaigns to help educate the community and Ohio at large about a career as a direct support professional. And so again, I'll put in one more plug in. We will be hearing from all of those folks on March 26th at our workforce symposium, which will be in Westerville at the Quest Conference Center. And thank you, Corey. Corey has put a link to that registration in chat for anyone who might be interested in hearing more about ways and creative and innovative ways to support Ohio's direct support workforce. Next. So, how can folks connect with us? If you're a provider or a direct support professional who needs support, we want to make sure that you know how to get in touch with us. If you are a family or a person with lived experience and you're working with a provider who you think could potentially benefit from some of the services we offer, we take referrals and we don't have a formal referral process. It's as easy as a phone call or an email to us. But providers themselves can reach out and ask for assistance. County boards can reach out and let us know that there is a provider or a direct support professional who might be in need of training or support. You all can reach out to us and let us know, especially if you are potentially working with a new or newly certified provider. We're happy to connect with them and make sure that they get started on the right foot, that they are starting this journey prepared so that they can be successful. And then also, we often get referrals internally from our peers and other members of our regional support teams as they're engaging with our customers and partners in the field and identifying a need for a provider to get supports from us. I think Corey also put a link to the regional teams map. So again, you're able to access that map on our website. The one thing that's really nice about this map is that it is interactive. So when you click on any of the counties, it is going to pop up all of the regional team members for that county and also give you a description of the area that they support. So that you know exactly who to connect with. So if you're looking to connect with someone from the DSP and provider support team, you will see their name on the map
You will
under
see
that
their name
county.
on the map under that county, period.
And you also can find their contact information in the chat. Again, I believe Corey or someone has put that in there. So thanks to those of you who helped put information in chat. Happy to take any questions, or if you want to, if you don't have one now, but something comes up at the end, I'll be on. So happy to jump in at the end as well if you have questions then.
And thank you so much. It's always a pleasure to collaborate with you and learning about the direct support professionals and providers and how they support families. One thing that I did not mention earlier is that we have a Q&A feature. So we encourage folks, as you have questions, to please use the Q&A. You will find a button at the bottom of your screen. And as you have questions, please submit them and our team will be happy to answer. I don't see any open questions at this time, but thank you so much, Anne, and thank you for your time today and for sharing. So I appreciate it.
Yeah, thank you. Appreciate the opportunity to be here.
Thank you. All right. So next, we're going to be sharing about the OhioISP. And in Beth Chambers' place, I believe we have Stacy Collins.
Meredith, thank you so much. Good afternoon, everyone. It's great to be here with you this afternoon. I am the stand-in for Beth Chambers, who is DODD's statewide manager of the OhioISP. And I am Assistant Deputy Director in our Division of Policy and Strategic Direction and get to work really closely with Beth and the OhioISP team. So I'm glad to be here with you all to give some updates about that initiative and what's going on across Ohio. So Meredith, you can go to the next slide, please. So within OhioISP, or what is the OhioISP, just wanted to start with anyone who's new to our meeting today. The OhioISP is the standardized assessment and plan that is required across Ohio for any individual who is on a home and community-based waiver or resides in an intermediate care facility. And it is a process that needs to be used across the state. And this process and tool is really to get to understand a person better and who they are and what their needs are, which then moves into an actual individualized service plan. And I'm going to go a little bit more in depth in that. Go ahead, next slide. So within the OhioISP, the why, we really wanted to make sure that we had one consistent assessment and plan that was used across the state that could be individualized to the person based off of their needs, their wants, that could actually be able to go with a person from county to county, to residence, depending on if they moved from an intermediate care facility or they moved to a different county. And so it was really an attempt to move from what we had once in our system was close to 500 different ways a person could experience an assessment and or a plan within our service system to just one that is that standardized template that asks similar questions, that lays out the same content in the same way. And so that is OhioISP. Next slide, Meredith. What we want to make sure of course, is that the OhioISP can be used for everyone. Like I mentioned just a moment ago, the OhioISP, though, is required by state rule to be used for any individual who's on a home and community-based waiver or any individual who is living in an intermediate care facility. This was actually required, as you can see, as June 30th of 2024. It was required that everyone use the template, and then as well as using the actual OhioISP template, they're required to actually transmit those plans to the Department of Developmental Disabilities online, and that was due by January 1st. We are not right now at 100% transmission, and so I'm going to give you some updates on where we are on numbers here soon. Yep. So with the OhioISP, there is, yes, it is titled OhioISP from a branding perspective and a communication perspective across the state, but the OhioISP actually has 3 different main components in it. One, it has an introduction page, which is the page that really talks about in a summarized way who the person is, what is important to them, and what's important for them. The important twos are the things of my wants, my likes. The important for is really about what I need to take care of myself medically, behaviorally, medications, diet, supervision levels, multiple different things where it kind of really outlines it in one introduction. It does include the option for individuals to have their picture on that introduction page. Then there is the actual assessment. And so this assessment is called the Discovery Assessment that's included in the OhioISP. And that assessment is really for a service and support administrator or a qualified professional working in the intermediate care facility to talk to the person and their family or their care team about what needs they have in multiple different areas of their life. And so the assessment asks a lot of questions. It asks about safety and security. It asks about hygiene. It asks about living. It asks about spirituality and social connections and daily life. So it asks a lot of things for, again, an SSA, which is that service and support administrator, or the actual QIDP, who is the actual case manager in our intermediate care facilities. Similar questions so we can understand a person better and their wants and needs. That assessment and the information that's gathered within that assessment then leads into the actual development of the individualized service plan. And that individualized service plan is that plan, that contract of services based off of what does a person need, who's going to deliver the service, and what's expected in that service. And of course, that's the document that everyone is completing and agreeing to. And so you will see those three main components in every Ohio ISP. So the full thing I wanted to explain is not the ISP. You will see the introduction page, the assessment, as well as the actual individualized service plan. And of course, within the Ohio ISP, there is contact information. So a person knows how to get in contact with the person themselves, their family, again, or their care team. Next slide. Within the specific sections, this just goes a slide that goes a little bit in depth for you on, again, what is included in all of the sections, but I just described that for you. So I'm going to have Meredith go to the next slide. Thanks, Meredith. So with the Ohio ISP, the way that a county board or an intermediate care facility can use the Ohio ISP is up to them. And so what's going to be really important is if you haven't experienced an Ohio ISP yet, it's going to be really important that you reach out to that SSA or that QIDP. So SSA is at the county board, the QIDP is in an intermediate care facility for information on what you can expect in the timelines for transitioning to Ohio ISP. I'm hoping everyone on the call today has experienced the actual Ohio ISP template in both the assessment questions and the plan. But each county board and each intermediate care facility is at a different place and actually transmitting the plans to us. And what's most important is that they are going through with you, understanding needs and wants, putting that into the individualized service plan, and then agreeing to that at the local level of either the county board or the intermediate care facility again. So communication with the groups that you're working with is really important. Next slide. And then what you can experience with transitioning to the Ohio ISP is I'm hoping you all have been exposed to the discovery assessment and the questions, have been exposed and experienced the actual individualized service plan. It is imperative that you all continue to be involved in the assessment and the planning process. You will sign off on that completed plan working directly with your intermediate care facility or directly working with your county board. Signatures don't happen after they're transmitted to us at the department. The signatures and those discussions happen at the level of with your ICF or they happen with your county board. Of course, if there is a disagreement, there is a process to that at the local level with the teams that you're working on. Once plans are finalized, so there's agreement, there's signature. Once all that's done, that is when the actual Ohio ISP is then uploaded into the Department of Developmental Disabilities system. We do have an IT system that's been developed to communicate between the county boards and their intermediate care facilities. If a county board or intermediate care facility is using DODD's system, it's in there, it comes straight to us. But with Ohio ISP, we do allow county boards and intermediate care facilities to choose to use private vendors of like technology solutions to actually use the technology for the assessment and plan. And then that actual vendor, that system will then transmit the information to us. So not everyone has been transmitted. How they're being transmitted does again depend on the county and the intermediate care facility. Again, communication is key with those organizations. And there is a way that people or families, anybody who is part of the team that has been identified as a team member and provided their information in the OhioISP will be able to get plans and the information from DODD. So that entire OhioISP packet, the introduction page, the discovery assessment, and the plan can be obtained from the DODD system once it's been transmitted. There are steps that we'll start going through with you on how to actually log into the DODD system. It's actually an Ohio system, and we'll start doing training on that once we get a little bit closer to 100% planned transmission to the state, because we don't want people to go through the steps to get set up and they actually can't access any information because it's not been transmitted to us. Team processes at the local level for both county boards and intermediate care facilities aren't changing with OhioISP. So Beth wanted to make sure that I covered that with you as well. Next slide. Again, so we talked about this. You can go to the next slide. I'm just right ahead of her slides. Sorry, everyone. And the other thing I wanted to provide, so we currently, the last 3 years, have been working with the original introduction of the OhioISP. So this version of the OhioISP is what was developed when the department worked with multiple different stakeholders, including people with disabilities and family members, county boards, those intermediate care facilities. We worked with multiple different experts across the field in developing what is that standardized template for Ohio. What does our introduction page look like? What does that discovery assessment look like? And what should our individualized service plan look like? And so we have been working across the state as well as county boards and intermediate care facilities and getting transition to this new standardized form. And what we've heard over the last 3 years is there are opportunities that both families and people with disabilities and our system professionals want, and actually being able to modify that template, because again, it was our first template. And so we talked to the field and said we would be willing to talk about the second version of OhioISP once we have everyone using the template and once we get closer to full transmission of OhioISPs to DODD. And so we are at a place where we are ready to get feedback, and we've been working on this over the last 6 weeks and getting feedback across the state through both an online survey, and we did in-person sessions across the state. We finished all of that up at the end of February. And so if anybody on this call participated in the online survey or of any of the in-person sessions, thank you so much for attending, for us to get feedback on that next version of OhioISP. We received over 1,000 online surveys back, and we completed a total of 10 in-person sessions, and just are really thankful for everyone who took time to give us feedback. We got incredible feedback. So right now we're analyzing all of the in-person and online feedback and putting it into an executive report, really sharing what we heard and sharing some recommendations about what our next steps would be for the second version of OhioISP. So really, again, appreciate everyone who attended those sessions. And then we just wanted to give you an update on where we were in regards to state transmission of OhioISP. So next slide, please. So just to give you some perspective in regards to the number of plans so far that have been transmitted to the department. So for home and community-based waiver recipients, we are just over 31,000 plans have been transmitted to us. So a total of 31,331. That is 70% of our home and community-based waiver recipients. For individuals who are in intermediate care facilities, we have 2,838 plans that have been transmitted to the department, and that is just sitting just under 67% of people living in intermediate care facilities. And then, of course, we are also watching our developmental centers, and we have 392 plans that have been submitted to us at around 65% of people living in the developmental centers. We have an OhioISP team that's working across the state and working with both county boards and intermediate care facilities and changing their processes and taking the steps that they need to transmit their plans. So thank you so much for allowing me to come to stand in today for Beth and give you an update around the OhioISP.
Thank you
Stacy,
so
we have a question here from our friend Debbie, who wanted to know, is the assessment that sets the rate as well? And I think she's referring to the level of assessment folks perhaps on our IO waivers receive. The overall assessment done on the individual, she's drawing a blank on the name. It sets the range for waiver funding. And this might be also a question for our Medicaid Development and Administration team as well. But is the OhioISP integrated into any of those things? I think is Debbie's question.
So right
Thanks,
now,
Corey.
oh, go ahead.
No, I was just gonna say thanks, Corey. I'm drawing a blank on the name. It's maybe some sort of a profile or something where you go through and you list out everything on it. It sets the range for the waiver.
Yeah, Debbie, I think you're referencing the Ohio Developmental Disability Profile, which is short
am.
for ODDP.
Yes, I am.
So the discovery assessment is an assessment that is separate from the ODDP.
Okay.
So the ODDP and our Medicaid team can talk about that one, but the discovery assessment does go through, instead of where you would answer the DDP and it would give you, you answer and it gives you a rating, which then gives you the number which determines funding. The discovery assessment is part of our person-centered planning process. So a requirement related to home and community-based waivers is that we do a full functional assessment in Ohio. And that functional assessment is the discovery assessment. So it goes through key life domain areas and is asking specific questions about what those needs are. What does that look like? It gets into a lot of details of what people need, kind of expands a little bit beyond the DDP. And then again, that leads into what would go into the individualized service plan. And
Thank you.
you're welcome. Thank you for the question. I don't know if any of my Medicaid colleagues, did you want to add anything additional?
I would just add, this is Jolyn Carlson, that the DDP sets the funding range for people on IO waivers, and then does affect the payment rates for shared living. So this is just for folks on IO waivers, the ODDP or Ohio Developmental Disabilities Profile.
Thanks, guys.
Thank you so much. Thank you, Debbie, for the question. And Stacy, tremendous work with getting all of the feedback and all of the hard work. And I really appreciate the breakdown of the process and the plan with the Ohio ISP. I do see one hand up and I don't see any other questions. So Dawn, I'm going to ask you to unmute so you can ask your question, and then we
Okay, can you hear me okay?
move on to our next speaker.
Can you hear
Yes,
me?
Dawn. Yeah, I can hear you, Dawn.
Okay, I am really sorry. Having a bunch of craziness today, but so one of the things that I've kind of seen with ISPs is they're not very accessible to people with a visual impairment. And I was wondering, is that something that can be changed? And I will also say I was going to do the survey, but I could not do it because it was all images. And that's not good. So I'm just thinking about how can that be changed over so that that can be accessible, and like what can be done to make the stuff accessible in the next version. Thank you. I'm sorry if I'm not saying it right.
I completely understand your question, Dawn, and appreciate your feedback. I know that we are working to make sure that the Ohio ISP is accessible out of our Salesforce application. So we will continue to have conversations with the vendors that are using the Ohio ISP. We can have some conversations with our county boards and intermediate care facilities, because that's where the information's coming from at the very beginning. So we can outreach to them and see what they're putting in place in their systems. We can continue conversations on our systems on how to improve it. And then in regards to the survey, Our apologies that you were not able to access it because it was images. I am happy to meet with you if you have the time to be able to go through the questions and get your feedback, and I can make sure it is included in our overall analysis
I
of the
would like
template.
that too. Yes, if you can send me an
Yep.
email,
Yep.
because the other thing I will also say, I have heard that there are significant accessibility issues with
Okay.
Salesforce. So you
Okay.
that might be where some of the problems may be coming from, is your system provider, or
Okay.
yeah, Salesforce. I have heard that. I I've heard it because there was another platform, there was another program that I was a part of that was using
Mhm.
Salesforce, and I was going to have to go through heaven and high water to get what I needed to get done, unfortunately, in that program.
Okay. Thank you so much for that feedback about Salesforce and the experience with OhioISP. I'm going to send you a direct email so we can get time scheduled to go through the survey together. Will that work?
Yeah, you have my email, right?
Yes. Yep.
Okay, thank you so much.
You're welcome. Thank you.
You're welcome.
Thank you, Stacy, for answering, and thank you, Dawn, for your question. Alicia, I see that your hand is up. I'm going to ask if you can drop your question in the Q&A. And I do want to move on to our Medicaid updates. We will be working behind the scenes to answer the questions that are in Q&A. Thank you again, Stacy.
My pleasure. Bye, everyone.
Oh, go ahead. I'm going to turn this over to Jolynn Carlson.
Hello. As Meredith said, my name is Jolynn Carlson, and I am the policy manager here at DODD in our Medicaid division. So I'm going to talk to you a little bit right now about some of the Medicaid updates, which involve posting for public comment our waiver amendments. So if you can go ahead and go to the next slide. So we have the self waiver, which is the self-empowered life funding waiver, which was due for its 5-year waiver renewal. Each one of our waivers is in theory good for 5 years and must be renewed every 5. And then when we make changes to the other waivers in between renewal times, those are amendments. So the individual options waiver and the level one waiver are also currently posted for public comment along with the self waiver for amendments and then the renewal. Corey is going to post in the chat feature the link to the public comment area. So these minor changes or updates that we have made to the waiver are now posted for public comment through April 3rd. If you look at the link that Corey sends, if you go down to the July 2025 where it says summary, that's where you will get the instructions on where and how to send any public comment in. So once the public comment period is over, we look at all of those comments, work with our partner, Ohio Department of Medicaid, and then we submit these changes and suggested new service options to the Center for Medicaid and Medicare Services, which was on our glossary page, CMS. CMS will have approximately 90 days to then approve what we have put in and made adjustments to on the waiver. And then our hope is that these proposed changes would take effect on July 1st of 2025. So next slide. So the first proposed change or update to the waiver, and this is going to be in all 3 of the waivers, is vehicle modifications. We are proposing that it become a standalone service. It has previously been in the IO waiver under specialized medical equipment, and as well as the level 1, and had been in the self waiver under participant directed goods and services. We felt that this service was important and really needed its own service. So it will be our proposal is that it's a standalone service in all 3 of the waivers. The next service that is going to be updated is, and stay with me here for a brief moment because it's going to seem a little weird. We are moving service animal training into assistive technology. And the reason for that is service animal training lives in the assistive technology space in the CMS technical guide. So per CMS, that is where that belongs. So again, that was also something that was either done in the self waiver under participant directed goods and services, or it was done in the level 1 and IO waiver under specialized medical equipment. But to, line up with the CMS technical guide, service animal training is going to be under assistive technology. So currently there's 3 components to assistive technology, and that's equipment, consultation, and support. There will be a 4th component, which will be service animal. So that information is in the waiver as well. The next item is that there is some phase 2 work going on for the waiting list assessment. And that involves some systems work and how SSAs will enter waiting list assessments into the system. And then our last new item is support and guidance around extended travel. County boards have struggled and had some concerns with being able to assure someone's health and safety when they are out of state or out of the country for extended periods of time. So this is in no way prohibiting people from traveling with their paid providers. Students who are out of state in college, it is not preventing any of that from happening, but helping teams really plan for, should someone be out of the country with a provider and something happen, how are people notified? How can we get folks back? And then it certainly supports county boards, helping folks understand what, healthcare, limitations are when they're out of state or possibly out of the country. And I think that was the end of my slides, but if anybody has any questions, and again, I encourage you to use the link that Corey put in the chat and make your public comment. And again, there are multiple ways to do that. We've already gotten a number of comments to the waiver feedback at dodd.ohio.gov website, but there's a way to also make a phone call and leave a message, or certainly send something through the US mail.
Thank you so much, Jolynn. It has been really helpful to hear from you how these proposed changes and updates will affect families and people receiving services across Ohio. So I really appreciate the interpretation and being able to explain it, and for families. I do see a hand up for Lynn Fogel, and Lynn, I'm going to ask you to unmute if you want to ask your question.
Thank you. Can you hear me? Okay.
Yes.
So regarding the vehicle modification piece of the waiver changes, I have heard that within the details of that part of the rule update is language that is going to prohibit some businesses that provide modified vehicles to families currently from doing business because they are not a dealership, but they are certified waiver providers. And one of the issues I've run into over the years in dealing with acquiring modified vehicles for my daughter is that in Ohio, more and more, we're running into basically a monopoly. You've got one company that has bought out a lot of smaller companies in Ohio, and they're almost the only game in town. So is she correct in that the language in this waiver update is going to prohibit people who are not a brick and mortar dealership from being able to provide this service?
Thank you so much for the question, Lynn, and we have gotten a ton of feedback on that very issue. We worked hand in hand with the Ohio Department of Medicaid on the vehicle modification rule and service, because they were also standing it up in their Ohio home care waiver. There was legislation enacted that centered around, and I'm just going to make sure I'm saying the words right, adaptive mobility dealer. We are, based on all of the comments, going to relook at this, and our legal team is taking a look, and we will certainly make adjustments if adjustments are necessary. But like I said, we worked hand in hand with ODM and felt like this was something that needed to be in the rule based on that legislation, but we will absolutely be looking at that. And we certainly do appreciate everybody's feedback and comments on that issue.
Great, thank you.
Lynn, that was a really great question. Thank you so much for raising that. I know that families and folks are really interested in this. And Jolene, we do have a question. If you could read the question and share your response.
Sure. Debbie asks, are the service animals covered by the waiver? The proposal that is in place is that the service animal training is what is covered under the waiver.
Okay, so not the animal itself, correct?
Not the animal itself, correct. And there are
Very good.
provisions to cover an annual veterinarian visit as well as required vaccinations for the dog, but not the dog itself on the front end.
Okay, so just real quick, just on the service animal training, is it currently covered and it's just being moved under assistant technology, or is that new altogether?
Yes, that is all. It is being moved. It had formerly been used under participant directed goods and services, and then under specialized medical equipment.
Okay, thank
And
you.
again, I know it seems a little odd for it to be under assistive tech, but that is where CMS has it in the technical guide.
Yeah, I mean, that kind of makes sense, I guess.
Thank you
Thank
so
you.
much, Jolene. I appreciate it. And
Yeah,
thank you for being here with us this afternoon. I am going to move right along to the next item on our agenda, which is our community life engagement update. Keith Banner, if you're available.
I am available. I'm just
Great.
waiting for you to let me start. Thank you, Meredith. I'm Keith Banner. I'm the statewide manager for community life engagement, which we have 6 community life engagement project managers across the state that support county boards, families, individuals, and providers and other folks to kind of help people access community-based services in ways that they want and plan for. So ready for the next slide. I wanted to focus in on one big project that we've been kind of, the community life engagement team has been responsible for, and it's the Adult Day Support Quality Pilot. Next slide. This is a pilot where we decided to kind of support adult day support providers to kind of define what quality care in that service is and improve the person-centered outcomes available to folks through that service, increase and improve the delivery of services to those folks with complex needs who are accessing adult day support, and then fund and sustain necessary infrastructure payments to enable those providers to engage in continuous quality improvement. This is one of the first projects we've done with adult day support providers to kind of help build their infrastructure and their ability to kind of support people in a way that's defined in a quality way. Next slide. So we spent over $20 million, have spent over almost 20 million, $21.2 million to support 99 providers. And we intentionally looked at a spectrum of size and scale for those providers, large, medium, and small, defined by their waiver claims. So this project has also affected over 2,100 direct support professionals, both full and part-time, who are working at those adult day support spaces. I'm going to put in chat the link to more information about the adult day support quality pilot. And you can actually go to that link, and there's a map, a heat map, where you can click, and then you can see where each of those 99 providers are in the state. and who they are. And next slide. So basically, a lot of that funding went to help build capacity. So we provided payments to each of the providers in the program around technology to improve efficiency, staff training, and then we also allowed them to establish a quality manager position within their organizations that would be kind of in charge of supporting staff, supporting the tech, supporting people and families to have a better way to kind of deliver and receive the service. And then we also used that funding to pay for outcome measures, right? We established and defined a baseline set of quality measures for adult day support providers in the first year. We're now in the second year, so that baseline is informing payments around quality measures, which I'm going to show you in the next slide here in a sec. So we're actually almost at the end of the project. It started in October 2023, goes through June 2025. So the last round of outcome-based payments are now getting released. We're going to spend the next 3 months with our providers in the project to kind of communicate how they did the quality version of Adult Day, how the quality manager position helped, how the technology helped, how the specific staff training to quality helped. So all that'll be in a couple of statewide webinars. And also we're going to do some broadcasting from different adult day support private provider spaces who were in the project to let folks know how they did. Next slide. So these are the measures we established to kind of be able to do the value-based payment structure. So basically we have an outcome tracking system that we have established in 2019. So the providers in the pilot use that to report. So just to complete the submission of the questionnaires is one of the first quality measures, right? Then the next is achievement of an experience in the support plan among the folks they serve, movement along the place on the patch community employment, participation in a DODD approved functional skill building or curriculum. A lot of the 99 providers didn't really use a curriculum that would help structure the day and help DSPs kind of understand the work they were doing. So we established, I think it's almost 20 different curricula that the providers could use. Some of them actually also built their own and kind of showed them to us so we could approve them. So now in those 99 providers, there's a kind of like a great spectrum of different curricula that they used. We also looked at a quality measure set around proportion of hours spent in community involvement and socialization activities. In 6, you'll see proportion of B and C folks. Those are acuity rates, people who have more complex needs, whether the providers are providing services to those folks. And then a continued engagement with those folks was measure 7. And then number 8 is workforce retention, how the people that they've hired, how they're staying on in the service and in the agency. So those are those measures. And like I said, the first year we established those measures and they reported on them and we built a baseline. Now in this second year, we're kind of looking at that baseline and see how they've done in that second program year. Next slide. I wanted to just kind of talk specifically about one quality manager that was shared by, I think, 3 providers in the project. David Small from Capstone Business Solutions. Basically, he was contracted by these 3 providers to focus on implementing that new technology around supporting documentation and helping DSPs kind of get their work more aligned and more efficient. And then a renewed focus on community engagement. He established trainings and a training curriculum for the DSPs to kind of help them move into community. And then also they focused on expanding their services, those 3 providers with his help, to folks with more complex needs. So that's really what the quality manager position in different ways did across all those 99 providers, is kind of trying to focus in on those measurements that we established, those definitions of what quality is in the adult day support service. And I think that is my final slide. Thanks for listening to me, you guys. And if you have any questions, I'm glad to answer.
Thank you so much, Keith. It's amazing all of the work that your team does. And I love that highlight to hear how all of your work is bringing great things for families and for people living with disabilities to become more independent. So thank you for your time, and I'm looking forward to learning more.
Hey, I have a quick question because I'm not smart enough to figure out how to put my hand up. Is that okay, Meredith?
Sure, go ahead.
I'm trying to figure out which button to press. Um, so, hi, Keith. I know that we exchanged an email. I kind of have maybe, I don't know if it's an oddball question or not, but I have a son who is at that transition age. He's 20, he's still in school. And I have started to look at some of the adult programs. And one of the things that I think I was taken back at is the number of individuals and the fact that there's not a lot of staff. But the second thing I was kind of scratching my head at is the overall documentation relative to an ISP. So when I think about documentation requirements for me as a provider, it's daily. When I walk through the adult day programs, I wonder, is their documentation requirement different from a, a parent, for example? Because I don't see a lot of services at some of the adult day programs that I'm visiting. And I'm just wondering, like, they're charging the waiver, but the kids are kind of, or the adults are kind of sitting there. So I was just kind of scratching my head in terms of what is their documentation requirement relative to an ISP. I guess would be my first question because I know that they're being reimbursed by the waiver, and a lot of the ones I visited, I didn't see any services taking place. So kind of a two-tiered question, I guess.
Yeah, I'd love to, like we said in our emails, kind of connect with you to get more information specific to your situation, obviously, and kind of walk with you through all that stuff. But they're like all the services through waivers, the documentation is kind of connected to obviously the services that they're supposed to kind of deliver based on the ISP. So all that goes into each person would have a different, obviously, documentation that was needed based on the services that are being delivered. And I could show you some other stuff that's more specific to each one because it's a compliance kind of review situation that we're talking about. So Deb, I sent you an email this morning, I think. So maybe we could set up a time offline to kind of walk through. I'd love to hear your experiences because we are really trying to reinvigorate and reinvent adult day support with the pilot, but also through our team, the community life engagement team, kind of reaching out to providers who aren't in the pilot to support them as well. So it would be great if we could talk offline and just kind of do a little deeper dive into what you're talking about. That's cool.
That would be wonderful. Yeah, I'll send you an email, Keith.
Thank you.
Availability.
Thank you so much, Debbie, for your question. Thank you, Keith, for your response. It's always interesting to see the different perspectives. So I appreciate it. I do want to hop in really quickly and give some updates for families. I do want to give some time for you all to connect with our leadership as well and ask your questions. So I'm going to turn this over actually to Corey Ferguson. So he can talk a little bit about his work with fathers.
Yeah, thanks, Meredith. So in 2022, a small group of people got together and started talking about how we are supporting fathers who have children with developmental disabilities. We decided there needed to be some work in this particular space. So we collaborated with some different county boards, some family organizations, the Ohio Department of Education, the Ohio Commission on Fatherhood, and a couple of years ago had our first father survey where we got a lot of information from dads talking about how they felt disconnected. They didn't have the supports that they thought that they could, have available to them. So we've started some work in that space, and we've decided it's time to resend out the survey and to get more data and information from fathers in Ohio who have children with developmental disabilities. So we have released a second survey that is currently open through the end of March. Just wanted to take an opportunity to share the survey with fathers throughout Ohio. So there is a QR code that is scannable within our PowerPoint that'll be sent out for resources. There'll be a link there as well. And then I'm also going to drop the link in the chat. So please feel free to share this opportunity with any men who are fathers in Ohio who have children with developmental disabilities. And the data we take from this will be really impactful and helpful as we think about different things we might be able to do as we go forward. So thanks, Meredith.
Thank you so much, Corey, for the work you're doing to elevate the voice of fathers in Ohio and father figures. So I'm looking forward to seeing what we learn. So these meetings happen on a regular basis, and I hope you're able to join us. The upcoming dates are July 9th, September 10th, and December 10th for Family Connection Forum. I have July 9th highlighted because that meeting will be in person in Central Ohio. So save the date and more information to come. We will be taking registration in May for that event. So I'm looking forward to seeing everybody's faces. Another great opportunity. So we've had some really great conversation here, but having face-to-face conversations is even better. So the Ohio Life Course team, as well as several of our colleagues from the different teams that spoke today, will be in person around Ohio. Next week we will be in Warrensville, and later this month we will be in Hamilton, Ohio, and then we have other dates. So we do have a QR code here that is scannable, and in the chat I hope somebody can drop the link to our registration. So yes, I hope to see folks. You will have a great opportunity to ask all the questions in person. So there's more ways that you can connect and continue to learn in between our meetings. We ask that you subscribe to our newsletters. There's tons of information for a variety of topics. And my colleague, Nathan Turner, also hosts a great podcast. If you love podcasts, Nate is a great host, and he has a variety of topics that he covers. Our next meeting for the Family Connection Forum will be a combined meeting with Disability Connect, so that's an opportunity for people living with disabilities, families, folks to come together in person in Columbus on July 9th. Registration will open around May. And similar to this format, we will have updates, and then our afternoon session will have an opportunity to ask questions and speak to our subject matter experts as well. And I really, truly appreciate everybody. I appreciate your time. Thank you so much for coming, and thank you to our subject matter experts. And I hope you have a wonderful afternoon. If there's additional questions, please feel free to reach out.